Days. We are live in the Element Well studio. It's our pleasure to welcome now Kimberly Hughes, Government Relations Director for the American Cancer Society, and also Laken Camp, Government Relations Director for the American Heart Association in Mississippi. Kimberly, Laken, thanks for coming on.
Thanks for having us.
All right, so this coming, let's see, what day is it? Thursday is Patient Advocacy Day at the Mississippi State Capitol. You guys are going to be down there, I believe, talking to legislators about the prospect of expanding the Medicaid program in the state of Mississippi. Is that correct?
Correct.
All right, Kimberly, tell us your thoughts about that from the American Cancer Society's perspective.
Well, we are joining forces on Thursday with the Heart Association, Leukemia Lymphoma Society, and the American Lung Association to have this Patient Advocacy Day to really bring that patient perspective to the issue of expanding access to care for patients in Mississippi.
Mm-hmm. Okay. So this has been a hotly debated topic the last couple of years. In particular, the new Speaker of the House, Jason White, seems to support the idea of full Medicaid expansion. The Senate not quite is on board. The prior Speaker, Philip Gunn, certainly opposed it, and the governor opposes it pretty strongly. So, Laken, what's your pitch? What's your elevator pitch of why we should do this?
Access to care. I mean, if you help all Mississippians, that elevates the progress of our state, exponentially. So it's a good economic decision. We know that. But it's also just taking care of the people that take care of us. I mean, we're talking about the working class, people who otherwise can't work for, whatever exemptions that they might qualify for. But this is a group of people who are falling in the gap and need to be taken care of. So we need to just focus on providing access to care for them. But yeah.
So you're probably aware that under the Inflation Reduction Act signed into law in 2021, there was a provision that enhanced the subsidies in the Affordable Care Act policies available there on the marketplaces, the exchanges, such that anyone who has an income that's below 150% of the federal poverty level, they can access private commercial coverage for no-cost premiums and also fairly generous subsidies for out-of-pocket costs as well. So that doesn't address those that have an income below 100% of the federal poverty level, the so-called coverage gap between what Medicaid currently covers, which is at a very low percentage, like 25% of the federal poverty level. What about advocating for that as a way to at least cover those that would be eligible for no-cost premiums in the exchange, as opposed to Medicaid expansion, which, of course, would have a cost component to the state of Mississippi? Is that something you guys have thought about? Kimberly?
Well, we are working with Congress, ACS CAN is, and I'm sure other organizations, to keep those subsidies in place because they have benefited a lot of people. But, there is a strong possibility they could go away. I know
End of this year.
Right, right. So there was a lot of discussion last year, I think, in the final conference report that did put people on the exchange. And, that may be a way that, works for Mississippi. We just urge the legislature to, maybe even bring back that conference report and let's finish what they started last year. They came a long way. And, there are 40 states that have expanded Medicaid in some form or fashion. So let's look at what other states have done and find a solution that works for Mississippi.
Laken, what do you think about the Senate's demand that any expansion of Medicaid would include a work requirement in the legislation? What do you think about that?
From a professional perspective, the American Heart Association will never support anything that includes a work requirement. But like Kimberly was saying, we need to try something. We need to put something out there. Now, we will never advocate for anything with a work requirement. We will continue to work with the Senate on what is, best for Mississippi. And we, stand by the fact that it's, legislation that does not include work requirements.
Well, and let's be honest, the House had the same stipulation, but I think the legislation that they passed last year was somewhat contingent on what the new federal administration would do with respect to work requirement, and if it would require a waiver, as you guys know, and if the federal government said, hey, we don't approve your waiver for requiring a work requirement, for eligibility. I believe the House version said, okay, we're still going to implement the program, whereas the Senate's version would not. That was the main distinction. And the Senate's version also stopped at that 100% of the FPL level. So what are your guys' plans, Kimberly, to lobby our legislature, both sides of the Capitol there, to put something together that could meet you guys' approval?
Well, we just see work requirements as a barrier, especially for cancer patients. You know, a lot of them are not able to work when they're going through cancer treatment. So, we just want to see some type of plan, to see something, and then, decide a position and work with them on, what might work. Just see them come together and collaborate on something and pick up the conversation from last year. We know that, there are very different opinions on both sides of the aisle, but we almost crossed the finish line last year, and hopefully they can get the deal done this year.
What about the governor? He's pretty concrete in his position that he would not support this program, this legislation that would expand Medicaid. Of course, it depends on whether or not what the votes shake out to be in the respective chambers, whether or not he could veto such a bill if it would pass through both houses. Have you talked to him about this and tried to persuade him on your position here?
No, not directly.
We have not talked to him, but ACSCAN recently commissioned a poll of GOP primary voters, and 58% of them support Medicaid expansion, and 74% of them believe the legislature should get the deal done in the 2025 session.
Okay. So. And I saw that report as well. You shared it with us, and we appreciate that. Mm-hmm. Is that something you've promoted and shared with lawmakers at the Capitol?
We have, and we'll continue to do so. That will be something that we'll share with them more specifically on Thursday, especially in the different Senate districts. We know where we've really got to do some work and to get their support, to let them know that their constituents support this issue, and it's the right thing to do for the health of Mississippians and for the economy. Right.
Has the Speaker, Jason White, has he indicated whether or not he intends, or Sam Creekmore, who heads the Health Committee, have they indicated whether or not they intend to introduce legislation for expansion again?
Not that I know of, but everyone is under the same mindset of, like, we do want to move forward. We want to take advantage of this momentum. It's just a matter of doing that, taking that action. And right now, of course, there's other legislation that is kind of, taking the, the spotlight off of expansion. So they're working it. I mean, they're still paying attention. They're still having conversations about expansion. But as far as specific legislation, no, we haven't.
To those who would say that this would impose a cost on the state of Mississippi taxpayers, and while certainly it's understood based on the incentives that the federal government is offering for a couple of years, and then the 90% FMAP, there still, over the long term, would be a cost, an increase in cost to the state of Mississippi. And it depends on whether or not you guys know the programs that have been proposed, whether or not the insurance industry participates, the hospital industry also perhaps could provide some supplemental funding. I guess where I'm going is, what's your explanation and what's your pitch to the taxpayers who say we don't want any more spending?
Well, right now they are spending. Their federal tax dollars are going to help states like California, Arkansas, Louisiana to give their constituents and their citizens better access to health care. So we want to bring those tax dollars home to Mississippi.
Okay. So you're looking at it a little more holistically as opposed to just within the state of Mississippi, that we're paying taxes. Your contention is we're paying taxes. Part of those taxes are to fund this expansion aspect of Medicaid. We're not taking advantage of that by receiving federal money back.
Exactly.
Which I think, based on latest estimates I've seen, would perhaps bring in another $900 million to almost $1 billion, right?
Correct.
Around that. Additional federal funds for the expansion group.
Mm-hmm.
How many do you estimate would be covered if we expanded?
Go ahead.
Well, I was going to say anywhere between 180 to 230, I believe, is what we've got.
There's been various numbers out there.
I've seen them too.
We just say over 200,000, but that we know there are thousands of hardworking, low-income Mississippians that would benefit. And I will say, back to your question about the Speaker and the House. Chairman McGee had her first committee meeting last
Medicaid,
week,
yep.
and did, say that the House was committed to finding a solution to provide
Okay.
health care for low-income, hardworking Mississippians. So that gave us hope, and we look forward to working with them as they move forward this session.
This Thursday, Patient Advocacy Day down at the Capitol. You guys with the American Cancer Society and the Heart Association will be there.
We'll be there.
Anything else real quick, Laken, you want to say? Got about 10 seconds.
No.
Okay,
I don't
we
think
good to
so.
go?
Sorry, 10 seconds.
Okay.
Get the deal done.
Yeah. All right. We're coming right back in the Element Wealth studio. Stay with us.